Next, let's watch a prep video from buccal, through distal to palatal. The operator returns to parallel mode at 1 o'clock. To secure the distal field of view, the patient's neck is turned completely to the right. For the operator's waist, there will be a slight bending to the left and a forward flexion to ensure a direct line of sight for both the distal and palatal surfaces. For the same reason, the operator's neck also has a slight lateral flexion to the left and forward flexion. In this case, since the posture is not comfortable for the waist and neck, holding it for too long will strain the body. An intermittent treatment rhythm is good, where you get into position for the prep, then release your waist and neck, and then resume the position. The suction tube is held in the left hand, and since the patient's neck is considerably rotated to the right retromolar pad becomes the lowest point, leading to a natural accumulation of water there. So, while you're prepping and taking breaks, you'll need to occasionally move the suction from the left side, inserting it deeper into the right, to intermittently clear out the collected water. There's nothing else particularly unusual. Let's watch a bit more of the video. This kind of posture involves a lot of bending in the waist and neck. While this position is momentarily acceptable, maintaining it for extended periods can strain both your neck and waist. Therefore, it is best to momentarily assume it, then return to a relaxed state, and repeat this cycle. Let's examine the prep position side from buccal to distal and palatal. Of all the prep positions, this is the one where the legs, torso and neck are bent the most, forming a C-shape. Knowing that keeping your body close to the patient's head minimizes bending, and that sustaining this posture for extended periods can strain your body, it's best to adopt this position for short intervals, then return to a normal neck and waist posture, repeating this pattern. Here, the red arrow indicates the viewing angle of the camcorder during filming, and the yellow arrow indicates the viewing angle from the dentist's eyes. When the neck is significantly bent to view the palatal aspect of the maxillary anterior teeth, or the occlusal surface of the maxillary molars, a substantial discrepancy arises between the camcorder's recorded image and your actual visual field. So, even though the camcorder's video in the upper right shows the target area of the tooth obscured by the mandibular obtrugate, resulting in a poor field of view, I want to emphasize that, in contrast, the actual dentist's eyes have a well-secured field of vision. In this photo, the yellow angle is the camcorder's field of view, and the red arrow is the operator's field of view. Let's see the prep stance for buccal, mesial, palatal. Since it's the mesial surface, the operator's position is shifted more to the right than for the distal, aligning parallel to the 10 o'clock position if possible. Since the waist and neck are bent the most in this position, as with distal and palatal, adopt the posture for short intervals, then return to a neutral position. One crucial technique for achieving an intermittent treatment rhythm involves performing as much of the adjacent surface preparation as possible while in a more comfortable buccal prep position, ensuring a clear field of view. I'll prep the mesial and distal adjacent surfaces from the buccal position, leaving only unseen parts, then prep from the palatal position as well. The posture in this slide is for finishing up, quickly addressing the remaining areas after all that preemptive prep is done. Let's watch the prep process from start to finish. Something to note here is, at this particular moment, you'll observe me using my hips to pull the stool, thereby positioning the operator's body tightly against the patient's head. You'll see that action. As I mentioned before, the closer your body is to the patient's head, the less you have to bend your waist and neck. On the left, the posture keeps the waist and neck in a normal range. The right image, however, shows the waist and neck bent outside of that normal range. Staying in a static position like the one on the right for too long strains your waist and neck. Therefore, I must emphasize that this posture should only be held dynamically for brief moments. If you compare the left and right sides, it's a subtle difference, but on the right, the distance between the dentist's body and the patient's head is closer. This specific body posture is designed to alleviate the burden on the waist and neck. The image in the upper right illustrates the waist bending towards the left side, and the lower right image displays the waist bending towards the right side. The yellow circle illustrates that when the waist bends to one side, the shoulder on that side naturally lowers. Also, the direction of the waist's bend, which is to the left in this example. and the neck rotates in the opposite direction. In this case, that's to the right. Please pay close attention to this motion. The purpose of bending the waist is to get a direct view of the palatal side, and the neck rotation is to align the field of view parallel to tooth number 22. Now, we'll move on to a different case from what I showed earlier, which involved prepping while grasping the suction with the left hand parallel to the tooth axis. Here's a mode where you maintain the toothbrush's parallelism, but the suction tube is hooked onto the patient's mouth corner, and you prep with it left in place. Let's begin by examining the incisor of tooth number 22. Since many of the posture elements are similar to the parallel mode with grasping that I previously discussed, I will now focus on the distinct differences. First, you need to master the technique of bending this suction. If you form it into a subpar curve, it definitely won't properly engage with the corner of the mouth. So, you should bend it to what might seem like an excessive degree, creating a distinct U-shaped curve. Once you've made the U-shaped curve, you now need to create a secondary curve on the suction tip, and there are two options. You can make the secondary curve bend inward, toward your body, or you can have it bend outward. For stable suction tube hooking in the maxilla, it's best to create a secondary curve toward the inside of the body, positioning the suction tip at the tuberosity near tooth number 17. Once the suction tube is hooked, the remaining posture closely resembles that of the parallel grasping mode. From a 12 to 12:30 position, the operator takes their place, then gently rotates the patient's head a bit more to the right than before. This is so that the water naturally collects by gravity towards the suction tip hooked on the right side. The operator's waist and neck should be positioned within the safest range, and it becomes highly convenient when you secure this mirror between your index, ring, and pinky fingers of your left hand, as it greatly aids in frequently checking the indirect view intermittently throughout the procedure. Also, use your first and second fingers to create a vertical wall with the obtrugate near the nose to prevent water from splashing. In the meantime, the remaining second and third fingers can also be utilized to provide auxiliary support for the handpiece head. There is one more reason why you need to create a secondary curve at the end of the suction tube, pointing it inward, toward your body. If you look at the photo, the yellow line shows the volume the suction tube occupies when it's curved inward toward the body. The green line represents the volume that the suction tube occupies when a secondary curve is applied to its end, bending it outwards, away from the body. However, should it occupy space as depicted by the green line, the suction's mass or volume will be situated more closely to the maxillary dental arch's 10th quadrant. This arrangement not only causes discomfort for the right hand rest, but also impedes the movement of the handpiece. Let's look at the prep of the mesial proximal surface from the buccal of tooth number 22. The patient's head is turned slightly more to the right than before, and the operator aligns in parallel mode at the 10 o'clock position. When preparing solely the buccal aspect, while you might be positioned at 10 o'clock, you have the flexibility to set the operator's position anywhere within the range of 10 to 2 o'clock, and even then, your neck and lower back can remain stable. However, when prepping the bucco-mesial line angle and the internal aspect of the adjacent surface, it is recommended to have the neck slightly protrude forward. This provides forward flexion, ensuring that your line of sight aligns with the tooth's axis, which is the direction of the tooth itself. The position of the rest and the suction tube will remain similar to previous settings. Let's check the 22 bucco-distal position. Because it's the distal, the doctor's position is at 1:30, and the patient's neck is rotated as far as possible to the right. With the suction tube positioned on the right side, your unencumbered left hand should grasp the mirror, using your index, ring, and pinky fingers. Simultaneously, your index and middle fingers should vertically hold the obtrugate wing, oriented towards the nose, to effectively prevent any water spray from the handpiece. The axis of tooth number 22, along with the bucco-distal line angle, is situated in this particular orientation. To ensure that the operator's gaze is aligned perfectly parallel to this axis, the operator's neck must be positioned in forward flexion. And moreover, a suitable degree of left lateral flexion must be appropriately incorporated. Your right hand rests on the number 10 through 19 anterior teeth for support. At this particular moment, if you observe closely, you will notice that I have already extended the handpiece line adequately by pulling it out sufficiently beforehand. As I get into position, if you pull out the handpiece line sufficiently in advance like this, before assuming your subsequent working posture, it is convenient because it prevents interference from the handpiece line tension while you are adjusting your posture, allowing you to freely access the handpiece into the oral cavity from various angles as you wish, without any hindrance from the line. It's especially useful when approaching perpendicular to the buccal surface. Positioning the handpiece vertically to the ground. See? A perpendicular approach. Let's examine how to prepare the adjacent mesial and distal surfaces from the palatal and palatal aspects of tooth number 22. When accessing the palatal side of tooth 22, parallel alignment isn't as useful. A perpendicular approach benefits visibility and instrument access more. The patient's head is turned slightly to the left, and the suction is placed at the left corner of the mouth. The operator is positioned at about the 930 position, with legs together like this. In order to obtain a direct line of sight perpendicular to the palatal surface, the dentist's waist is gently bent to the right. Additionally, the patient's neck undergoes forward flexion, then right lateral flexion, and finally a slight left rotation to optimize visibility. With your right hand, grip the handpiece with a long hold, not short, and use your fourth finger to rest on the right masseter muscle. When holding the handpiece with a long grip like this, having auxiliary support is more stable. Since the suction is placed here, my left hand is free. With the third finger of your left hand, you'll establish a rest on the hard tissue of the anterior teeth. Then, use the second finger to support the neck of the handpiece, which helps to gain more precise control of its movements. Let's take a look. We will provide auxiliary support in this manner.